Good morning, everyone. My name is Liz Zacharias. I'm a director at Campbell Tickell, and I'm responsible for all our supported housing, care and health projects. I'm a co-host of the webinar this morning, along with my colleague, John O'Connor. Just like to welcome everyone. Thank you for joining us for what we hope is going to be an informative and interesting session on older people's housing issues in Ireland. John is going to sort of chair the first half of the webinar, and I'll chair the second half. But before I hand over to John, just like to tell you a little bit about Campbell Tickell. And also I've got a few housekeeping issues to go through. So Campbell Tickell, we are a housing consultancy for those who don't know us. We've been working in Ireland for about 12 years. And we've worked with a majority of approved housing bodies, large and small, and also some of the councils, the local authorities in Ireland. We also worked with the housing agency on design of all parts of the regulatory system when it was a voluntary system. We've also worked with the ICSH on a financial roadmap for approved housing bodies to try and point a way forward for some of the financial issues that are arising from the current AHB funding. And then we've also done some work with the Irish Refugee Council and with the Housing Alliance. We are actually going to be at the ICSH conference next month. So if you want to come and talk to us about any of the issues that come up today, or indeed any other sort of social and affordable housing issues, I hope you'll come up and have a chat. I'm now going to hand you over to John O'Connor, who will chair the first part of the session.
Good morning, everyone. You're all very welcome. As Liz was saying, there's a very interesting set of, presentations this morning. A lot of work has been put into it, by those presenting. So I think we'll all learn a lot from what we're going to hear this morning. Just one question maybe for us all to consider before we get into some of the main details is how long are those of us on this webinar expected to live? If you could just think about how long is our life expectancy on average? And the answer to that is on average we would be expected to live till our mid-80s to our early 90s. Women, on average living a few years longer than men. But it just gives you an indication if we think about ourselves and how the population is getting older, the effects of that and the needs. In terms of what we're going to cover this morning, some of the main themes is first that demographic shift in the age of our population, and the urgency in terms of our planning of our housing system, our healthcare system, our community infrastructure. The urgency has increased in relation to that. And as you'll hear this morning in terms of the demographic shifts, one kind of key fact is that by 2040, over 25% of our population will be over the age of 65. We're going to be looking at age-friendly housing principles, independence, autonomy, social inclusion. We're going to be looking at the diversity of housing and the support models, from independent living, assisted living, to specialised living. So we'll hear from the presenters on all of that. We're going to be looking at the current policy, and the evolution of that policy. And, the government and government departments here would emphasize, the need for independent living, where possible, right sizing in terms of our accommodation, but also the supports we need, for certain groups of people. And then lastly, kind of one of the main principles we're looking at is the social value and community impact, and how kind of age-friendly housing reduces healthcare costs. It delays having to move into institutional care, but overall kind of improves the quality of life. And we'll be looking at some other, specific issues in terms of loneliness and social, isolation. So the presenters are going to cover quite an amount this morning. So I'm going to move into the first session. So the first session we have Joe Gallup, Clan Housing Manager with Clúid Housing, and Kate Cottier, of the CEO of Fold Housing. And they're going to set the scene and give us an overview to start with. So I'll hand over to you now, Joe, for your presentation.
Lovely. Thanks very much, John, and thanks, Liz and Campbell Tkell for putting this together as well. So I'm going to cover about 10 minutes and I'll hand over to my colleague Kath there. And we're just going to be talking about setting the scene here, just a bit of information on where we are at the minute with older persons housing in Ireland, and just a bit of that context as well. I'm Joe Gallup, so I'm a housing manager with Clan Housing. Clan Housing is the age-friendly service that falls under the umbrella of Clúid Housing Association. So we offer age-friendly, which roughly over 55s housing, and we're all around the country doing that. So what I'm going to cover today, just a bit of why this matters, what the need is for age-friendly housing, talk a bit about the demographics and some of the health and the kind of social issues there. And then also what do we actually mean by age-friendly housing? So I'll touch on a bit on design and supports and the kind of community aspect there as well. Sorry, I'll mention when to pop to the next slide. Thanks. Yeah, pop on, Liz, to the next slide. Oh, wait, so why this matters? And next slide, please. So the demographic context, as John was talking about there a little bit, the over 65 population is growing very significantly. There's a 30% increase between 2022 and 2030. Obviously, we're well in between those years now already. And as John mentioned there as well, by 2042, we're looking about a quarter of the population will be aged over 65. And that's growing and growing into the future years as well. By 2040, we're looking at a 70% increase in the over 65 population. And to put that into context, 2025 we're roughly 16% of the population. So you're looking at an increase from 16 to 25%. 2040 sounds a long way away. We're talking 15 years time. So these are big changes in a relatively small time frame. What's really important here as well is looking at those trends in housing tenure. So there's more older people living in private rented sectors, an 83% increase across the last 5 years. There's a huge shift there in where older people are living, as well as the overall kind of demographic picture. So that's households with at least one person aged over 65. And obviously that, as we all know, the private rented sector, there's going to be increased exposure there to issues around affordability, issues around security of tenure, and whether that could be a home for life, and also those issues around whether it's the most suitable housing that we for older people in terms of those adaptations, in terms of the location and community and supports that you can get with that as well. Pop to the next slide there, please, Liz. So looking a little bit there just about aging well and healthcare aspects of that. So around 1 in 5 older adults, 65 plus, report difficulty with some form of basic daily activity. So what we're talking about there is the everyday tasks that most of us will take for granted, things like bathing and dressing, shopping, preparing meals. And we know from this research that there's strong predictors of these difficulties are pain, chronic pain, could be multiple medications, depression, and that strong link between health and functional independence. Those issues increase with age, but there's also living arrangements, social supports are a really, really important part of enabling people to live independently and overcome those barriers to those basic daily activities. So what we can do in terms of the housing, what that implication is for housing, having those supports, the homes that are designed properly and adaptable is really important there to make sure people are able to live independently and get by with the daily activities. And the next slide there, please. I think the other aspect of this that's really important is loneliness and social isolation. So there's been some really good research in the past few years on this kind of really specific to Ireland as well. So about 1/3 of adults, older adults aged 65 plus, report feeling lonely or lacking companionship. That was an Aware survey from 2023. And we know the number of older single person households is growing, so increased by 15% between 2011 and 2016. So this issue of social isolation and loneliness is, again, the demographics are shifting in that way that it's becoming more and more of an issue. And Ireland as well, isn't it? Really, it's one of the highest loneliness levels in the EU when we can look at the EU loneliness survey. So of all adults, more than 20% say that they feel lonely most of the time or all of the time. So it's a really big issue there. But we also know that it's so closely linked, loneliness and social isolation with health outcomes. So a really good 2021 study looking at TILDA data, as longitudinal data. Older adults experience loneliness, social isolation had a 43% higher risk of death over 7 years, even after accounting for other health and demographic factors. So loneliness, social isolation is really important as a public health issue, and the impacts on physical and mental health are really huge. And what's also really important about it is it's a bi-directional relationship. So poor health itself can lead to that loneliness and social isolation and in turn feeds back again. So we could be talking about an acceleration in decline in physical and mental health as a result of this. And again, housing really important here to overcome some of those barriers. Thanks. Let's move on. So what do we actually mean by age-friendly? So the concept of age-friendly housing, developed by the Homes for Life EU project, provides a really good framework to kind of understand the solutions we should be looking at. So, essentially what we're talking about is places in which people and communities and services and settings and structures work together in partnership to support and enable us all to age well. So supporting independence, supporting autonomy, allowing residents to remain active and healthy. And as mentioned, that really important part around social inclusion and engagement with community. I think what's really important to remember there as well is the diversity in the older age cohort as well, and the diversity of circumstances that older adults come from or in, and the experiences they have there. So there's a lot to that. Pop on there. I'll try and wary of time. We'll just through the last few here. So I'll touch on housing design. I know this will be covered as well. So this is roughly a framework from the Centre for Excellence in Universal Design. And I'll just run through these very briefly. So universal design, what we're talking about there is guidelines for adaptable and housing that allow people to age in place. Things like step-free entrances, wider doors, accessible bathrooms. And what's really important is that adaptability as needs change over time as well, that we can move the layouts, change layouts. And what that's really talking about is the property itself, your home itself. What we also have through the Centre of Excellence in Universal Design is building for everyone. And this is talking about whole environment design principles. So neighborhoods and public spaces, and that housing support is regardless of age or ability, is accessible and adaptable as well. And the other part as well is the dementia-friendly dwellings, because there's some other areas there, practical guidance, that is really important for where dementia and kind of cognitive decline is an issue as well. So we're talking about sight lines, lighting, color contrast, simple layouts. And there's some really good guidelines around that as well. I suppose where we can see that how important this is, healthy age-friendly homes evaluation, uh, these kind of interventions, adaptations, navigational support, shown to improve the quality of life and shown to reduce loneliness and support health as well. So all really important stuff. Next slide, Dan. Thanks very much.
Just one thing, Joe. You might just be conscious of time, please.
Perfect.
Thanks.
I'll wrap it up here. Yeah, not a bother. So I'll just finish here on this slide where looking at the range of options there are, offers there are kind of with housing, and I suppose where Clan sits within that. So the spectrum of older person housing, we go from independent living, which is low support, which is what Clan, my organisation, provides, where we talk about those universal design principles. We have some communal rooms and office space, but actually the caretaker, the support there is really focused on well-being and signposting, and would be considered low support. I'm sure my colleagues later on will be talking a bit more about the more high level support, the assisting living, which would include perhaps co-location with HSE services and on-site staff, and then specialised living as well, which would again go one step further and have staff on site 24/7, medical care and things like that. So I'll hand over there to my colleague Kath to pick up on the second half of the session. Thanks, John.
Thank you very much for that, Joe. And there's a lot of information in those slides that Joe provided. I'll hand you over now to Kat, who will continue this session on scene setting. Over to you, Kath.
Okay, listen, thank you very much for inviting me to talk today, and I'm delighted to be here. So just to say, Fold Housing, we spent a significant amount of time last year writing our new strategic plan and have a vision of a society where older people in Ireland have a great quality of life and choice. And if you just move on to the next slide there, our contribution to achieve this is set out in our purpose. The first two bullet points here are, I suppose, ingrained in our DNA, our North Star at Fold, which is to develop and manage homes that older people want to live in. And then, within that built environment, to empower residents to live fulfilling lives and to foster thriving communities. Our third purpose statement, I suppose, reflects our ambitions for the future, and I'm going to talk a little bit more about that later. But I think some of the information that kind of Joe has outlined, and hopefully I'll be able to kind of expand on in my next few slides, kind of identifies the need for it and why we've put it so clearly in our purpose. So just moving on to the next slide. So we have two distinct service offers for older people in Fold. We have 471 older persons independent living homes across 10 sites in the Greater Dublin area, and then 112 residents in our housing with care developments, which I'm going to talk about in a minute. Now, this is very similar in terms of our independent living to what Joe's service offer described at Clan. So I'm not going to kind of go into it too much, but I'm just going to highlight two things here. Is that all the referrals are from the local authority into our sheltered, our independent living homes, and that they're predominantly one bedroom. Now we can have debates on that, maybe not here, but we can discuss it at other times. And that does reflect the need from local authorities and the people on the housing list. And Joe talked about the number of people growing older in private rented and come through a social housing route into some of our older persons housing. The other thing I want to say is about the advocacy and the signposting. So with our kind of skills and expertise, we're well able to support people to access care, but we don't deliver care ourselves. But we do have kind of good oversight to work with individuals through either temporary or kind of more longer changing needs as people age. So I'm just going to move on to the next slide here and talk a little bit about housing with care. And I'm going to concentrate a little bit more on this because I think that the people attending today maybe wouldn't know as much about housing with care and what Fold does here, and that it exists within Ireland and how it's different from other models of housing for older people. So we have two schemes in Dublin, 56 residents in each, with a kind of a frail elderly or dementia or cognitive impairment diagnosis. Um, through all intents and purposes, you might walk through the door and feel that it's like a nursing home, but it doesn't take long when you look under the bonnet to see that it is actually acutely different. Residents have their individual rooms. They're kind of reasonably spacious, but the reality is that all kind of recreational space is communal, whether that's the dining rooms, the kind of the kind of activity rooms, the pool room, the various different things that are there, and even kind of communal smoking areas. People don't smoke in their rooms, so that there is kind of ways of living there that are kind of defined. All kind of personal care, kind of meals, cleaning, laundry is provided for people. Um, and there is 24-hour personal care. The reason I've got so many colleagues in these photos here is because the vast majority of people who work at Fold deliver care to the residents who live in our housing with care schemes. So the residents that move in have a diagnosis, or not an assessment, sorry, not a diagnosis, of having low to medium care needs. And that is actually done through a nursing home care panel with the HSC in very close liaison with local authorities because of the assessment that they do there as well. And we're HICWA regulated to be able to kind of meet the needs of people with low to medium assessment, and we receive HSC funding to do that. So just to give you a flavour of the people that move in, as of last Friday, our clinical nurse kind of gave me the information here that 52% of our residents have a medium dependency assessment, 28% have a low dependency assessment, and 20% on the given day of last Friday from their care plans, of which everybody has one, could be considered independent. Okay. And I suppose one of the things that's different about nursing home versus ours is that we don't have a clinical nurse on site all the time. It's not a kind of it's a social care model of housing rather than a clinical model that you would see in a nursing home. And our kind of our clinical nurse kind of covers our both sites and works for 20 hours a week. So, the 20% independent, we'll come back to that in a minute. And I think another important thing just to say is that of the residents that were there last Friday, 26% have a diagnosis of mental health conditions. So I suppose people, when they move in and come into the route of housing with care, have struggled on multiple occasions to live independently at home, and maybe have fluctuating care needs, which is what you can kind of see in the level of people that maybe kind of are diagnosed as kind of an independent dependency level, but have definitely not been able to live independently for over a number of years, and that's what leads them into a housing with care environment. So it is quite unique. There are very few organisations, and certainly we're the only ones that kind of that are HICWA regulated that we know of in a housing association environment to deliver this level of care within the setting that we have. So if you just move on to the next slide, this is a graph or kind of a diagram here. Sorry, if you move on to the next slide. Oh yeah, there we go. This is from Housing Options for Aging Population. It's a government document, and it shows the degrees of care associated with different housing solutions. Now, the number 4 there, independent living, is very much the vast majority of what Fold delivers, and an awful lot of people and AHBs in Ireland and local authorities have been working in this area. And I suppose where we kind of see a real gap at Fold is the 5 and 6 assisted living and specialist living. And that's what we deliver in housing with care, and feel that there's kind of more scope to meet people's needs if that area is given a focus on over the next kind of coming years. So I'm just going to let you know a little bit about what our residents say. So this is on the next slide. This comes from some wonderful time I spent with our residents in our independent living homes. And, they're very vocal and very clear about what's important to them. So there's a lot of other people talking about design today, but design is very important. It's the little things as well as the big things, being able to change your own light bulb as well as actually having level access. So lots and lots of things there that are important. Compatible and integrated integrated locations, being in kind of areas and part of communities, but being compatible with things next door to you to be able to kind of have a peaceful environment. A real desire to work with us to maintain homes, and a very, very conscious of value for money, and being part of the solutions to kind of ensure our sustainability and long-term viability. Just moving on to kind of life and services, I think there's kind of a real recognition from our resident groups about the diverse communities that they live in, and not wanting to, and really challenging us to ensure that we're inclusive of those diverse communities. There's a real recognition that some people find loneliness and staying healthy as a challenge in older age, and really want us to kind of be able to support things that kind of enable that. And I think Joe gave the real statistics there that help understand why that's important. Another aspect of it was a real kind of wanting us to recognise how much residents support each other, and think about the ways that we can help that flourish. And it's not about the services we deliver all the time, but it's actually how residents support each other. And a big part of that is actually having communal facilities. We don't have communal facilities in all of our schemes, and where we don't have them, they are definitely missed. And then the final point there about don't want to move from my home. People have moved into independent living homes and definitely don't want to move out, and having a care pathway to enable them to stay at home is really, really important. And I suppose very gratifying, and I think something that's really important is that I suppose at scale, this type of housing isn't that old in Ireland, but yet the people that are living them, hands down, would make the same choice again. And the reason they would make that choice is because of the safety, security, and peace. Those are the words that they used on that. So just moving on to the next slide here, Joe talked about the kind of the demographics in Ireland, but I suppose I kind of brought it down to kind of our fold population and our demographics here, and kind of trying to look at the difference between housing with care and our independent living. So 78% of residents in independent living homes are under the age of 79, and actually 50% are under the age of 69. So very young. Some of us are reaching that kind of quite quickly. In housing with care, 45% of them are actually over 80. What does that tell us? I suppose it makes sense. Older people need more care, therefore they should be in an environment where they're able to receive more care. And in terms of kind of single occupancy in our kind of independent living homes, 90%, 98% of people live alone, which kind of again is replicated in what kind of Joe has said before. In November 2023, we assessed that only 14% of our residents in our independent living, 14 residents, not 14%, 14, even a lot less in terms of percentage, actually received care packages. What does that mean? It kind of means maybe in younger age, there isn't the need for care packages. But it also means that maybe independent living reduces the need for care packages because of their good design, because of the kind of the opportunities for health and well-being. I suppose at Fold, we're acutely aware that at the relatively young age of our residents living in older persons in the independent living, and over time we will be managing a different demographic. And I actually think that that's probably mirrored elsewhere in the AHB sector and an awful lot of the new housing that's built for older people in Ireland. I'll just give you two.
Kath, you just sorry, you might just watch the time, please.
Yeah, no, it's fine. I've actually just got a couple more things I want to say. So just, I just give you two examples of kind of, we had to move two residents recently from independent living because they needed higher levels of care. In one environment, they went to a nursing home because we didn't have a care pathway. And the reasons that both of them moved out is because fall risks at night and not being able to respond quickly enough to support them in that environment. In every other aspect, they were able to live more independently. In the other environment, we actually had a care pathway from independent living into a housing with care because they were co-located. And it's a really good example of what we can do. So just finally, kind of in terms of my final slide, what next? There has been massive, our success story is kind of the delivery and supply of older persons housing that will increase, as a sector, but that also with the local authorities and the work by Age Friendly Ireland and lots of other people, that really, really has to kind of to continue, because it's obviously we're able to see that it's making a difference. AHBs need to plan for person-centred care and cost-effective care because our residents are so young. And I think this is where the kind of the new model of housing that Fold really want to work in collaboration with other people to develop is really important. And it, for Fold's perspective, it kind of enables us to kind of be a care provider and a housing provider. But more importantly, it's actually about meeting the needs that are emerging in Ireland. And I stole this picture here from my friend, actually, in a colleague in Clan. You know, these boats, they weren't lifted and taken somewhere else, or being able to kind of thrive in an environment before the water disappeared. You know, and I'm sure nobody really planned for that. And I think we need to plan for that. And that's why it's so central to our purpose over the next few years. So listen, thank you very much. And I look forward to having more conversations over the coming months and years on this, because it's so important. Thank you.
And thank you very much, Kath, and thank you, Joe. As I say, that ends session one, but there's a wealth of information in Kath's and Joe's presentations, so well worth reviewing it afterwards. I'm now going to move on to the second session, which is on the policy position. Our first speaker will be Rosalind Malloy. She's Head of Policy, Practice and Communication with the Housing Agency. And then Emer Coveney, who's the National Programme Manager for Age Friendly Ireland, will speak. So I'll hand it over to Rosalind now to give her presentation.
Thanks very much,
Rosalind.
John. Yeah, thank you, John. Thank you, Campbell Tickell, for the opportunity to speak today. So I'm going to look at three areas. We've already heard about changing demographics, but I will go back and just look at them because they have such an impact on the policy that we have. So I'll look at a whistle-stop tour of policy over the last 20 years, and then I'll touch briefly on the financing of housing. So if we go to the next slide, please, and the next one. And again, so the demographics, I just want to point out here is the acceleration in our aging, kind of the proportion of the population age 65 and over. At the last census in 2006, the population of over 65s in Ireland was 468,000, or just, I suppose, under 500,000. By 2025, less than 20 years later, this has doubled to 861,000 today. And the CSO has projected that the number of people aged 65 and over is going to increase by another 1 million people by 2057. So just I suppose, the urgency and the scale of change that is happening in Ireland, just to kind of reiterate what previous speakers have said. So we just move to the next slide, please. So again, just touching back on tenure, which Joe mentioned. So where people are living is important to look at in terms of policy. And this slide shows the tenure and number of older people in 2016 at the census, and then again in 2022. So not surprisingly, all tenures have seen an increase in numbers, but the real increase can be seen in the rented sector. As Joe said, we've seen an increase of 83% of older people living in the private rented sector in just 6 years. And this is followed by the AHB sector, which has seen an increase of 66%, and then the local authority sector, which has seen an increase of 34%. If we move to the next slide, please. And this increase in numbers currently living in the rental sector is also echoed by the increase seen in the numbers of older households who are eligible for social housing supports and on the local authority waiting lists for housing. So on the left-hand side, if you can read that graph there, you'll see the numbers of all households qualified each year for social housing supports on the waiting list from 2016 up to 2024. Over this period, the overall numbers, we're seeing a decrease. But on the right-hand side, there's a different trend line for those households aged 65 and over, where we see an increase of 25% since 2016 in the number of households waiting for social housing supports, up at over 4,000 now. These figures, I suppose, point to the growing role both of local authorities and also AHBs in terms of providing and ensuring, I suppose, that there will be homes for the population as we age. So moving on to the next slide and the following slide. So I've gone through key policy documents, not all of them, over the last 20 years to look at policy and how it has evolved in terms of housing older people. So firstly, the state has taken, has to be said, into account older people and their housing needs in every plan that I looked at. In 2005, there was the view that most people were living in their own homes, and grants were a key part of enabling them to remain living there. But even 20 years ago, there was a mention of facilitating choice and autonomy, and that the role of AHBs in providing what was then referred to as sheltered housing was recognised, with an acknowledgement that there needed to be interagency collaboration to meet the care needs. Moving on, 2 years later, in the Housing Policy Statement Delivering Homes, Sustaining Communities, the role of local authorities in planning for the needs of an older population was called out. The local authority also operated the rental accommodation scheme in the private rental sector, and this was to be promoted as it was seen as providing, I suppose, stability and security for older people in the rental sector. And local authorities were called on to operate financial contribution schemes, and I'll touch on this again later. But in the same year as 2007, the National Development Plan was published for 2007 to 2013. And here we see a growing emphasis on long-term residential care, or I suppose the clinical side that Kath mentioned of nursing homes. So more than half of the investment that was planned to go into housing for older people was being made available for nursing homes, and just under half to, I suppose, enable and provide support for people to remain living at home independently. Moving on to 2011 and the Housing Policy Statement, the country was now looking back at what had gone wrong. The emphasis now was tenure neutral, housing no longer being a means of wealth creation. There was a continued emphasis on the rental sector through RAS and leasing to house older people. And AHBs were now clearly placed at the heart of the government's vision to deliver housing. If we move to the next slide. So from 2016 onwards, a more coherent vision emerges with Rebuilding Ireland. The challenges in relation to housing a population that is ageing is clearly called out. And I think there are three key themes within policy that follow through to today to meet this challenge that was called out as being significant. Firstly, to support people to live independently in their own homes and, importantly, in their own communities. Secondly, to provide a range of housing choices. And here, rather than sheltered housing, we here refer to adapted or specialist housing. Thirdly, housing alone won't be enough for the challenge. There has to be cross-departmental interagency working. So this plan was followed up with the joint policy statement we saw earlier in 2019, which firmly acknowledged the joint role of the Department of Health and the Department of Housing. The plan, again, to support older people to live independently in their own homes and own communities with a greater choice of options. It also called out 10 years after the Fair Deal scheme was launched that there should be a rebalance of care away from nursing homes and long-term residential settings. In 2021, all of these three themes were reiterated again, and in Housing for All, the role of the local authorities in future needs planning, which we saw back in 2007, is called out. Moving to today, and we'll move to the next slide, please. This is where we're now at in terms, I suppose, of the latest policy. This year, the new programme for government set out some measures relating to older people. And later this year, we should see these coming through in the new housing updated plan. So what was set out in the programme for government, again reflecting the three themes from 2016. All of the 5 points on this slide from the programme reflect this, but this time there's an emphasis on practical, perhaps reflecting the scale of demographic change facing the country. It's about how we can work with what we have, how the homes we have can be made more suitable, how can older people stay living in their own communities in new homes, either on sites that the local authority will find, in new homes built on the same plot, right-sizing through the housing financial contribution scheme to a more suitable sized home within the community, either a local authority or an AHB home, and doing so freeing up another home. And underpinning all of this is the new Minister and Ministry of State. Here we have a picture of Kieran O'Donnell, and he is Minister of State at the Department of Health with special responsibility for older people, and also Minister of State at the Department of Housing, Local Government and Heritage, with special responsibility for housing. So just turning to this slide, so we've heard in the previous two presentations, we'll hear again, but just to kind of reflect on terms of choice and the range of kind of housing accommodation options that through the years we've heard about in policy. I suppose these are 3 publications that the Housing Agency published between 2016 and 2020, the Thinking Ahead series, which I would have worked on. These pointed to the gap. Again, CAF brought out the gap in assisted and specialist housing. And we profiled good examples, including some examples from Fold and Clon, that AHBs and local authorities have built. And that third report, Thinking Ahead, looks at, I suppose, from a financial aspect, why it would make more sense to build more of these types of homes at all different levels. So you can go onto the Housing Agency website to access these reports. I'm just moving to the next slide. This is going to be covered in more detail, but I think from a policy point of view, later on by John, but from a policy point of view, the supported housing enrichment place, this was just launched in July this year. And I suppose this just goes back to 2016 and Rebuilding Ireland, when it was kind of named as a pilot project for housing with care in that plan. So moving to the next slide. So I've been asked to talk about finance and give a kind of a general overview. So in terms of how social housing is funded, there are three schemes: CAF, CAS and SHIP. In 2021, with the Affordable Housing Act, we also see an introduce of cost rental schemes and affordable purchase schemes. And from a kind of private sector and remain living in your own home and public sector, the state does have a range of grants administered through the local authority to enable people to stay living in their own homes. So moving on to the next slide, funding social housing. So in terms of funding social housing, these 3 schemes, CAF and CAS, are for AHBs and SHIP is for the local authorities. It would have been, I suppose, the CAS scheme, which would have been used in the past to fund most of the housing built by AHBs for special groups, including older people. And the funding scheme enables AHB to have capital funding of up to 100% from the state to build the housing, with allocation of the homes, 100% of these, to those eligible for social housing supports. However, just in terms of the CAS funding, if an AHB takes up less than 100%, up to 95%, then the AHB does have the option to allocate up to 25% of the homes to those not necessarily eligible for social housing supports. And CAS also provides, importantly, funding towards communal facilities, which is so important, that we've seen from research time and again. In terms of CAF, the CAF payment and availability agreements, I suppose it would be true to say that many AHBs are now using CAF with payment and availability agreements to fund housing for older people, which they might not necessarily have done in the past. And for local authorities, it's still the SHIP scheme, which is used to fund older people and general needs housing. So moving to the next slide and then the slide after, please. We'll just skip that one for time. So in terms of affordable housing, because I suppose this is since 2021 changing the scene in terms of mixed tenure and what's available and options for the sector. We saw in the earlier slides the growing number of people age 65 and over living in the rental sector. And over the last 20 years, policy promoted RAS and leasing to provide more secure homes in this sector for older people. So now we have cost rental as a new tenure in Ireland, which aims to provide secure, affordable and long-term rental housing with rents that are below market levels by at least 25%. And this as a tenure will be providing homes for people as they age and as they reach 65 in the rental sector. And I suppose we need to be kind of taking that into account in our future planning. I'll move on to the next slide, please. So just in terms of right sizing, I think it's kind of important just to reflect on this. It's one of the actions in the 2025 programme for government, which is to standardise the older person's housing financial contribution scheme. And many local authorities offer these schemes. Here we have an example of what they're doing in South Dublin County Council, which they recently reviewed, and you can find lots more details on their website. But between 2022 and next year, South Dublin County Council plans to deliver 600 age-friendly homes. And these are to be allocated to those aged 55 and over. They'll be allocated to those who are eligible for social housing or who are in social homes already and are right-sizing from larger social homes. But there's also an allocation of 20% of these homes to older people who will be right-sizing from homes and who are homeowners that they own in the private sector. So the council can either buy their home at an agreed discount, or the homeowner can sell their home on the market and make an agreed contribution to the council. And the contribution or discount is then scaled by age, which you can see in the box here. So I think it's interesting, just in terms of the programme for government, just to reflect on one of those schemes. So moving to my next and last slide. So in summary, to conclude, Ireland has seen and will continue to see significant growth in the number of people aged 65 and over. We've seen this significant increase in the number of older people living in the rental sector, with a growing role for local authorities and approved housing bodies in terms of, I suppose, meeting the needs of this population. We also see the need for local authorities to be really planning and future proofing in their plans. Policy has evolved over the 20 years. Again, I suppose there was a view 20 years ago, there was less urgency, but that's no longer the case. And so today we see that policy is about providing those practical choices, independence, enabling older people to live in a range of different types of housing in their communities that we see both Kath and Joe were talking about, and the vision there. And finally, we're seeing changes, which I do think will impact on this area in a form of new tenure in cost rental, providing homes for older people. Okay, thank you very much for listening.
And thank you very much, Rosalind. Moving now to Emer is going to talk to us and in terms of some of the work of Age-Friendly Ireland and housing policy generally. Over to you, Emer.
Thanks, John. And you can go on to the next slide, please. So, yeah, briefly, I just want to speak about the wider context for age-friendly work in Ireland and the wider ecosystem that's developing around supporting ageing communities, because housing is obviously one domain in the World Health Organization's global framework for developing age-friendly communities. We have a national programme in Ireland that is hosted in local government as a shared service. So we work across all the local authorities and we work under these 8 domains of the World Health Organization programme, which include things like transport, social participation opportunities, making sure older people have the right information, the right community supports and health services. And the whole package is needed in order to make sure that people continue to have a good quality of life as they age. So housing is central to that, but it's interrelated with all of these other domains. Move on to the next slide, please. This is a photograph of when the World Health Organization came to Ireland in 2019, and they gave us the accolade of being the first age-friendly country in the world. And this is on account of the fact that we have consistent structures set up through all areas of administration, through the local authorities, and working with multi-sectoral stakeholders. So we were the first country to kind of take this a national approach to having an age-friendly programme in every local authority and a national shared service supporting it. And we were given the kind of honour. So we were in a leadership position in this kind of global movement. And you can see this not just through the sort of housing provision that's coming on stream now, but also in many other areas of programming through the HSE, through, transport providers and that. Next slide, please. And this is just a diagram of the evolution of the Irish age-friendly programme. It was originally responding to the World Health Organization's vision that was published in 2006. And we took an agreement here in Ireland that we would deliver through the local authority sector, with County Louth developing the first local age-friendly programme model, which was then scaled up across all other local authority areas. We have an international declaration here, the Dublin Declaration on Age-Friendly Cities and Communities, which has been signed on a number of occasions. The shared service, the national programme is operated as a shared service, and within that there's a number of strands of work. So Declan Gaffney here is going to speak later about the technical programme of work in relation to age-friendly housing, but we also have the Healthy Age-Friendly Homes service, which is a new service that supports older people to remain living at home. And we also have very strong community development component to the programme, where our local programme managers are delivering a range of activities and initiatives to older people to ensure that they can remain healthy and well and take part in their communities. Next slide, please. This is an organisational diagram just showing that we have very good cross-government support for age-friendly work in Ireland. We currently have 6 government departments represented on the National Advisory Group for Age-Friendly Ireland. along with the An Garda Síochána, the policing service, the Chambers Ireland representing the business community, and the health service executive, and 3 local authority chief executives. So the World Health Organization would say that Ireland is the country that is closest to having a systems-wide approach to age-friendly. And what we mean by that is that we're trying to get it embedded in all of the government departments' national policies and in all of the main funding streams and that. And you can see from the number of departments represented on the advisory group that we're very much moving in that direction, where each department is recognizing that population aging has to be built into their policy, and they're, kind of feeding down then through the funding schemes coming from those departments. The shared service itself is hosted by Meath County Council, and yeah, that's fine. So the governance is anchored in Meath County Council, and yeah, we can move on to the next slide, and I won't labor on this one because I think people have covered the population statistics. But just the one point I wanted to make is that, we have the aging population, and obviously there'll be increased, prevalence of people with dementia and with mobility issues and that. But in general, Ireland does have quite good statistics for self-perceived health status. So, for example, 79% of people rate their health as good or very good, and I think that ties in with this recognition that people are, want to remain healthy and well, want to remain independent and living in their own homes. So the shift away from thinking that people are going to necessarily move into nursing homes, that they want to kind of be supported to remain living at home. Next slide, please. Programme for Government. I think Rosalind has already drawn attention to this, but I suppose in the age-friendly programme structure, you can see in the 2025 Programme for Government that there's very strong embedding of age-friendly principles and recognition of the work that we're doing under the banner of the World Health Organization. And here I'd like to draw attention to the references to the older people's councils, because all of the work we do in Age Friendly Ireland is grounded in our participation and consultation with older people's councils, which are citizen-based structures established in each local authority area, and they also have a national network. And these basically are the service user perspective feeding into the local age-friendly strategies and all of the national work. And they will also take part in, community-based assessments of the built environment, so new housing developments, new public buildings, tourism facilities, and that older people's council members give their time to kind of give us feedback and help to shape their local communities to make sure that they're really age-friendly and suitable for all of the generations of older people that are to come. The Programme for Government has also made reference to, other supports for housing, such as the national rollout of the Care and Repair Scheme, and Rosalind has already referred to the right-sizing scheme. Move along there, please. As I referenced some of the government departments on the National Advisory Group, these are just examples of where ageing is being really well embedded into things like, obviously in health service and sláinte care, and that a recognition that older people want to be, receive their care close to home and in the community. Town centre first, that approach to regenerating the town centres. There are huge opportunities there for older people's housing in town centre locations where they're going to be located close to the shops and services that they need, the health services and public transport as well. And Garda Síochána have a very good strategy on older people and how they're going to support older people in their communities. And even national frameworks like Creative Ireland, there's specific funding and specific calls for using creative activities to engage with older people and to support their health and well-being. So again, just trying to illustrate here that it's across the board in many of these national policies that ageing and older people's views are very much at the centre. And moving along, please. And I probably won't get through all my slides at this stage, John, so I'll just finish up on the next two. In every local authority, there's a local age-friendly programme structure. The technical advisor in the local authority would be somebody with an engineering or architectural qualification or planning, who's there working on things like the design guidance for housing. We also have the Older Persons Council, an age-friendly programme manager, and an interagency group called the Age Friendly Alliance. And that brings all the kind of main public sector agencies together to work on a local strategic approach to ageing. So when you're talking about age-friendly housing, looking at the transport that is going to the housing, looking at whether there's a community centre where health service can go in and support the people living there as well. And next slide, please. As I mentioned, the Older People's Councils, we have our annual convention with the Older People's Councils where we hear what their issues are. And I just wanted to highlight, if you go on again to the next slide there, please. We do hear, and sorry, go on again. This is just some of the issues that are reported through the Older People's Councils, but we asked them to kind of give us feedback on what are the priorities. You can see there at the top that 63% of the participants at the recent convention this year spoke about housing as being the top priority in terms of right-sizing options, wanting multi-generational housing, affordable and accessibility issues in housing. And there's some of the issues that we are working to support them on. Thanks, John. I'll finish on that.
Thank you very much, Emer, and thank you for being very prompt in your presentation. So that ends session 2, which gives an overall situation in relation to policy in Ireland and has been developing. We're going to go on to a 10-minute question and answer session now, just to catch up and let's all take a breath. And Holly Holder, who's a senior consultant for care and support with Campbell Tickell, is going to field the questions. So I'll hand over to Holly for this.
Thanks, John. So we've been extremely efficient by answering some of the questions as they've come up, but we've got 2 live questions, which I will just read out. So one from Ruth O'Reilly, who's asked, are current cost rental schemes including age-friendly homes that incorporate universal design principles? And then another question from Daisy Armstrong, who has asked, what challenges exist in the development and implementation of age-friendly housing policies in the rural areas of Ireland, and what measures are being taken to address them? So hand over to the panelists who would like to answer both or one of those questions, please.
Yeah, well, I can come in on the first one, but I'm sure maybe Kath as well might have, well, I'm not sure. But just in terms of the new cost rental homes, I checked with our head of affordable housing, and actually all new housing units are incorporating or to incorporate universal design principles. So that, I suppose that answers that. Thanks.
I don't know if anybody on the of the speakers can kind of comment on the sort of rural housing and older people's aspect.
Yeah, I can comment briefly on that, Liz. We Clan have a few age-friendly schemes in rural areas as well as in urban areas. There's challenges in obviously developing new ones when you obviously have to factor in demand. We would do a very thorough kind of assessment of kind of needs and demands in each area that we're looking to develop in, and obviously rural areas that can be more challenging to essentially kind of hit those kind of criteria. The other big challenge that I think we see in rural areas is actually those wraparound supports and other kind of what else is available. Because clearly in rural areas we're less likely to have those kind of other agencies, other support that we'd like to see kind of close by on our schemes.
Okay, thanks, Joe. Sorry,
I could come in again, Liz, there just on 2 things. This is just purely from research that was done a couple of years ago on the Thinking Ahead second, where we looked at case studies of housing, and I suppose there were 2 challenges in terms of rural housing that come to mind. One, I suppose, is that in order for, if we're talking about supported housing and looking at that spectrum of care and models 4, 5 and 6, if I get them right, with either independent, medium or specialised, what we found was that where it makes sense for AHBs and local authorities was when you had enough of those kind of housing kind of together, so at least 50 plus housing units. So I suppose, in terms of rural, I suppose it's kind of centralising that, and everybody can't stay living in that type of housing in their own village potentially. But that might have changed since. And the other thing was the funding, just in terms of CAF and P&A and making the rents make sense in rural areas for AHBs to enter those locations.
Thank you. Thanks. That's great. Okay.
We've also got another few questions in the chat, so thank you very much. And please do everybody add in some questions as and when they come to you, and we will answer them now or later on in the session. So we've got one here, which is about the size of the properties. And so Ryan was wondering, particularly with regard to AHB delivery, whether there's demand for one bedroom units for older people, or is there an expectation for 2-bedroom units, thinking about extra room for storage and family coming to visit, etc.
Yeah, I'm happy to chip in there again. So, Clan, we'd absolutely have a mix of 1-bedroom and 2-bedroom predominantly. It's some occasionally slightly larger, and there's a good demand for both. Most of our properties will be 1-bedroom, but there would be plenty of situations where a 2-bedroom would be more appropriate, where we'd have particularly overnight visitors for care reasons would be one of the main ones. But extra room for family visits as well, for storage. There's very frequently good reasons why those kind of situations are more suitable as well. So we do see strong demand for both kind of 1-bedroom, 2-bedroom, and occasionally larger.
And I think when we've looked at research, and I know that there was some research done about people downsizing, and when they asked people what they kind of wanted in a future home, there was quite a lot of response around people wanting 2-bedroom housing. So I think there's definitely a kind of demand there, and a need, as you say, Joe, to kind of have a flexible approach to that.
Wonderful. We've also got another question here from Mary, who's wondering, when planning new housing developments, is access to public transport considered? For example, is provision made for a local link bus stops at the entrance or within the housing development?
Well, that's the purpose of the A20 Alliance structure in every local authority, that there's a sort of senior level interagency group that includes the local authority, the transport company, the guards, the health service. So that kind of, planning and discussion should take place at that forum as part of the local A20 strategy. If there's housing being developed, it's not done in a vacuum just by one agency, that there's sort of a collaborative approach. I don't know, Declan, do you want to come in there?
Yeah, generally, with any new development, transport is one of the criteria that's discussed. So at pre-planning stage, there would be, opportunities to speak about parking, transportation links. So if there's an opportunity to develop a particular bus stop, it's brought up, and it's something that I know a number of consultations I've done with private developers, something that I've advocated for, particularly for age-friendly housing, where some older people may not have access to a car, that that they have access to transport, public transport. So it certainly is, from my discussions, it is certainly considered and should be considered at pre-planning stage.
I know we've got a few more questions. I think I'd just like to sort of hold off on responding to some of those, but if the panel could have a look at that and maybe put in your type in your responses to that. And I think I'd like to move us on to the next session, if possible.
We're moving now to session 3, and this is the finance profile of housing for older people, and the costs and the risks. Now we're joined by Bruce Moore, who's the Chief Executive of Housing 21, and he's going to give us the perspective from the UK. So thank you very much, Bruce, for coming. So I'll hand over to you, Bruce.
Thank you, John, and thank you, everybody. And so giving an English perspective and particular issues around Housing 21, we're a provider in England. I'll say a little bit more about that in a minute, but it's been really interesting listening to the perspectives from the Irish point of view. We all have an aging population. We're all lots of aging longer, but I think it's like I think Rosalind said about the acceleration. It feels like a tsunami that's coming, and I think people use the reference time bomb, etc. But it feels the wave hasn't actually completely crashed yet. But we're running in this sort of time where we're running out of time to prepare for our aging population. So next slide, please. And really, people saying it's their predictions or projections about aging, I think it's pretty much hardwired in. We know that the population is aging. We know the proportion of older people is increasing. So 2038, almost a quarter of people will be aged over 65, over retirement age. That creates a huge pressure in terms of the whole economy and how we're supporting that aging population. And we know it's happening because that process moves through these cascade positions. The people who are going to be in that older cohort have already been born. And next slide, please. So just quickly finishing off that sort of wider demographic context, we know that it's going to be largely that growth is going to be of single households and also from the old population. So this is a projection of the people aged over 90 in England, and that really shows that sort of very old population who have that higher care and support and that other need, and the pressures that are going to come with that. So 72% of the household growth in the UK to 2050 is going to come from people aged over 65. So that's a huge pressure in terms of new household growth and perspective. So next slide, please. So a little bit about Housing 21. We formed 60 years ago, just over 60 years, in 1964, at the start of really what was the housing association movement in England. People were saying that the house association movement is like the third arm. Well, when, private sector, public sector, and then the housing association movement, at the start, we were very much like the 11th finger. It was a very small part of the provision. The funding came from an organisation, a government body called the Housing Corporation, and that funded that. The famous film Cathy Come Home was 2 years later. So 1964 was the start of this housing association movement. We were formed by the Royal British Legion Housing Association to house people who'd served in the armed forces, that huge need for housing at that time. But we changed our name to Housing 21 in 1993 when we started housing all older people. Next slide, please. And in the UK, there are 1,500 housing associations in England, but most of those are really, really small. So I think it's the top 5% of housing associations provide nearly 60% of all the housing association properties. There are some really, really big housing associations in England who provide over 100,000 properties. We're probably in the middle of that top order. We've got about 24,000 properties. And so we're about 35th in terms of numbers of front doors. We're about 12th in terms of turnover, and we're third in terms of the numbers of employees. We've got 4,000 employees because we're providing some care as well. We work right across England, so there are very few housing associations work right across England, probably just over a dozen or so. But we're also one of the very few organisations, housing associations, that specialise in only providing services for older people. So next slide, please. So our purpose, this is by my sense of humour, purpose, we help older people live with dignity and autonomy, providing high quality housing with care and support. And next slide, and our positioning is that we're not a mainstream housing provider. We don't provide general housing, but equally we don't provide institutional resident or institutional care homes. So we're in that specialist housing for older people. So either old terminology, but the retirement housing and extra care. And we actually one of the challenges we face is we all use different words to talk about the same things and the same words to talk about different things. But we've got two services. So next slide is that we have two services. We split it out into what we call retirement living. Previously, probably we called sheltered housing. I think Joe talked about low support housing, and then we've got extra care, which is probably the specialist housing type option. Our retirement living, next slide. We've got about just short of 14,000 properties in 460 or so locations across England. This is where people got their own front door, self-contained apartment. There's a communal lounge, access to an emergency call system. We have a local housing manager who's on site for an hour of time per week per number of properties. So if you've got 30 properties in a scheme or a court, then they'll be on site for 30 hours a week. The residents don't provide any direct care services from us. Average age about 75, average tenure, average length of stay with us is about 6 years. Next slide. They are contrasting with our extra care. Again, the same sort of property position, same independent living, own front door, self-contained apartment, but as well as a communal lounge, There'll be restaurants and hair salons, and there are other distinctive factors. As well as having a restaurant and an on-site meal provision, there's also 24/7 on-site care provision. There are care workers based on site, providing a domiciliary service, not an institutional service, but they're based on site. It allows an alternative to residential care where couples can stay together despite their care needs. Not much of a higher average age, but a much shorter tenure because people are living there with higher frailty. And then into our extra care, and we've got nearly just over 10,000 of those properties. And so next slide, we're also the care provider into about half, just under half of those extra care services. So we provide about 48,000 hours of care a week. And so, that care is really important. We'd like to provide more of our care in an integrated model, but sometimes we're not the cheapest. We provide a very good quality care and we pay our care workers well, hence our lower care worker turnover. But that's what part of the challenge is in finding the right employees and the right cost of provision and getting that funded. Next slide, please. So in terms of patterns of provision, a lot of social provisions, the light blues on this chart is social provision, and the dark blue is for sale or private sector provision. You can see that a lot of it was the sheltered provision, very little shared ownership, up to 1988. 1988, the UK and England had a different change of funding, so we had to, at that point, access private finance and leverage our development to that point to help leverage more private funding and private funding as well as grants into our developments. As a result of that, you can see the amount of provision fell off quite substantially, and that's partly because developing housing for older people is more expensive, has more challenges and more complexity. So now we're facing, in this chart there is from provision from 2021 onwards, none of the strategic partnerships, so the larger housing providers, are developing housing for older people. Zero has been presented by the larger providers since 2021. Housing 21 has provided actually about just nearly a quarter of those 5,000 units. So out of 70,000 units that developed, only 5,000 have been developed for older people. So real pressures in terms of making sure more provision is being made for this huge demographic and this requirement. So the next slide, please. We really are facing a position where we're arguing about who's got the biggest slice of the cake, but actually the real issue for me is the cake is just not big enough. We just have too little provision in terms of what's there. And then in terms of funding that provision, next slide, all our provision is at social rents. So market rent typically would be about £1,000 a month for a rented property. Affordable rent, which is the sort of the more commercial side of things, about 800. We provide social rent, which is half the market rent position. So trying to make things work at a social rent is more of a challenge. All our services are housing benefit eligible, and our positioning as an organisation is to really try to provide the best services possible for people of modest means. So really that process, and then really we rely on capital grants to help that funding go through. Next slide, please. And I apologise for not converting this into euros, but this is pounds. So times it by times it by 1.15 or whatever the exchange rate is. But effectively, our retirement living properties are in the range of £100 to £130 a week in terms of the rental position. Our extra care is probably a little bit more of that, so £120 to £150 a week. And if you go to the next slide, please, you'll probably see a little bit of background to that. You can see the orange is 2-bedroom properties. So that question that was just asked is, we're providing much smaller properties in traditional retirement living. That's because they were built older properties built in the 70s, 80s and early 90s. And now I think we've recognised that to make our properties desirable, they need more 2-bedroom properties. So retirement living, given that they're mainly 1-bedroom properties, rent and service charge inclusive our average across our portfolio is about £160 a week. Our extra care is about £260 a week. That's reflecting higher rents for the 2-bedroom properties, but also the higher service charges that come with the wider extra facilities. But comparing extra care, £260 a week, you struggle to get, and that's about £1,000 a month. You struggle to get a residential care place in England for anything less than £1,000 a week. So it's about a quarter of the cost of a residential care provision. So really good value in terms of that position. And then the service charges on top of the social rent. Next slide, please. Is really quite an important consideration. So we have a variable service charge. So every element of it is created in consultation with our residents. A big element of the service that people pay is for the people element, so the manager on site and the support. Lifts, grounds and trees and other maintenance are all parts of that service charge component. But trying to make it affordable and not have those. The private sector has quite high service charges. We're trying to make sure that they're good services but modest, and that's why we don't charge any of the communal makeovers and the refurbishment of our properties to service charge. We could do, but we don't. And also we're putting free Wi-Fi into our services to make people more digitally connected. And again, we don't charge for that as part of the process. Other charges, next slide, we have is energy. So often we have communal heating systems. We've got all our properties to what's called Energy Performance Certificate Level C, which is the standard that we've been on our route to net zero told to get to. So we got that to 2022 ahead of the sector, which go in that process. But communal heating systems are a bone of contention because everyone's paying the same, and some people have got their heating up and their windows open, and others being more frugal, they're paying the same. And then the other element of the charge that we have is the peace of mind charge for the connection to the 24-hour system. We've moved over to digital systems now. It used to be an analog, pull a red string. I don't know if you have that in Ireland, but we've modernised that and eventually brought them into the 20th century. So that's the position in terms of the services. We also, next slide, have a lot of people who are in that sort of lower middle range. So they've got in terms of about 150 to 300,000 of housing equity, not really enough to buy a suitable property in older age to move to. And that's a real challenge in terms of that provision. And so we have an offer called shared ownership, but actually the current, next slide, please, sorry. So the current provision of shared ownership in the UK or England is quite flawed. So you can buy a portion of your property and then rent the balance, but you can staircase the amount that you get. If you get to 75%, you pay no rent. But if you have a 70% stake, you're paying rent on the 30% balance. So there's an incentive to staircase up to that 75% and then stop, which means that actually it's ceased to be a smooth transition when you resell it. There's a lot of small print. If renting, you shared ownership, you own 50% of your property and you're renting the other 50, half of it, you've still got full liability, 100% liability for all the maintenance and repair elements. Shared owners and people social renting, you can have an us and them component. People in social rent have a different outlook in terms of, and often more care needs, and the people who are shared owners think they're better and different. And then when you've purchased it and having to try to resell the property on the open market, it can be really difficult in terms of the estate agents don't just sell that, but while you're trying to sell it, your relatives or whoever still have to pay out the service charges, still have to pay the council tax and other elements there. So it has seen as being a disadvantage to people, and then when they're trying to sell it, it's quite a hard process to get that across. So we're finding, next slide, is that this isn't a great offer at the moment. We did a report with an all-party parliamentary group looking at the position of shared ownership. We've taken the view to take a time out in terms of developing any more shared ownership. And the all-party parliamentary group looked at the challenges of a rental population, and we've had some statistics from Joe and Rosalind about the shift to the private sector. We take the view that the private sector is not a great place for people to age in because of the higher rents and the affordability of that and the pressures that has, and also some of the suitability of the properties. But that again drives that need for more provision for social rent. Also, we have the myth that everybody is in older age is a homeowner, and we can now see people in their 40s not being homeowners, and they're going to go into older age without that home ownership equity. So there is a challenge and need for more social provision and more rented provision in that sector. Finally, just a few points to me is that despite all these challenges, satisfaction, I think, is a real driver for this. We set our goal to have 95% resident satisfaction. We haven't quite got there, but we're getting there. We have identity. You have the same one foot in the grave comedy show, but there's a guy in there called Victor Meldrew who's aging and all the challenges of aging, and his byline is, "I just don't believe it." But a lot of people say older people are always happy, and it's just not true. And so we have just as many challenges in terms of providing for older people as I think any other provision. But our overall satisfaction, next slide, is really strong. We've just hit 90% satisfaction, moved up from 87 in the last year for rented. And for shared owners, traditionally it's been lower, but we don't see why it should be. But we've got to 83%, which is a lot higher than our sector averages. So we put a lot of emphasis on resident satisfaction and to looking at the small things to do. Two more slides, I'll get there. And then so plenty of challenges. Next slide is the financial challenges, affordability for residents, net zero. The profit margins in developing social older people's housing are lower because of the service charges and the care charges, which means it's not seen as good for general providers. What we need, last slide, effectively, is a strategy. It was really good to hear about age-friendly Ireland, but we had a strategy in 2010 called Lifetime Homes, Lifetime Neighbourhoods, but the new government hasn't picked it back up again. So unless we wake up and smell the coffee, we're going to be toast. So we do need a strategy for our ageing population, and I'm happy to answer any questions or look at them in the chat as we go through. So I know I've gone over time, but thank you very much.
Thank you very much, Bruce. Thank you for sharing all that information with us. And again, for all participants, again, it'd be good to look back at Bruce's presentations and get all that you can from it. I'm going to hand over now to Liz, who's going to chair session 4 and session 5.
Thanks, John. So the next session, we've got Declan Gaffney, Technical Programme Manager for Age Friendly Ireland, talking about local authority delivery and sharing some kind of case studies and funding models used. And then we've got John Hannigan from Circle VHA, who's going to talk about their delivery, particularly the scheme that is called Inchicore scheme. So we'll find out about some of those developments there. And I'll hand over to you, Declan.
Thanks, Liz, and thanks for Campbell Tickett for the invitation to speak this morning. It's great to see sessions like this being created. I think from my role within local government, and I have a role across all 31 local authorities, it's great to see the collaboration and the sharing of knowledge and stories. Really, our ambition is to provide more housing for older people. Next slide, please. And I'm going to try and speak as quick as Bruce because I have a good bit to get through, and I don't want to eat into John's time. But before I talk about the models and our toolkits, it's important that we understand how we age and the prevalence of a disability as we age. And we need to factor that in. Government policy is to strive for providing homes to afford people to age in place. So this graph here is from our latest census, and it shows the prevalence of a disability by age group. And as you can see, as we age, that prevalence of a disability increases, and we need to prepare for that in terms of how we provide age-friendly housing and applying age-friendly principles and universal design into the core of planning and design. Next slide. So we've touched on housing, but care, and this is a report going back to 2008 from the HSE, but it looks at living at home and the risks of falls. and the importance of the design elements that I mentioned, and I mentioned further now in my presentation. But one takeaway, falls are the highest safety risk for older people at home, and providing level access that Joe spoke about, and that extra space is really important in enabling people to live safely at home. And it has consequences. It has burden of cost on our healthcare providers in terms of necessary admission to hospitals and the provision of care. So, housing and the way it's designed for older people is very, very important to mitigate those potential hazards. Next slide, please. This one has been brought up, but I suppose my presentation is going to focus on that independent housing model. And that's probably the mainstead of housing that local authorities provide, and I'll focus on that. Next slide. Emer has spoken about, the creation of age-friendly communities, and my role is really to look at three of those key those domains: housing, transportation, outdoor spaces, and buildings. And those three have a huge impact on the other five. If I don't have an accessible home, if I live in an apartment block and I can't, access the common areas, let it be heavy fire doors or no lift access, it impacts in terms of my social participation. So the built environment has a huge impact on creating age-friendly communities, and it's important that we understand that. And as planners, as architects, as engineers, we ensure that new homes for older people are designed to include universal design and age-friendly principles. Next slide. So we've done a lot of work in local government in creating publications, co-designed with older people, but really bringing universal design, which is the bedrock of age-friendly housing, into the fore. And both of these documents, the one on the left there is an age-friendly document, is available on our website. I won't go into any great detail, but there's 10 steps in terms of providing age-friendly homes. And that's both for independent living and care assisted living typologies. The document on the right, the one on the extreme right, is one that we've recently launched with the Centre for Excellence in Universal Design, which Joe has mentioned. And we work closely with the centre in our publications and informing best practice and design guides. Universal Design Guidelines for Homes in Ireland is the parent document and really the blueprint when we speak about universal design. So the checklist focuses on the internal spatial requirements of homes. There's 5 different typologies, and it's really a toolkit to inform the sector of the key elements when we look at the internal requirements of homes, age-friendly homes. So it's a really useful document. Next slide, please. This is one of the typologies that's in the checklist, and it looks at the key components, level access, but also the spatial requirements in the bedroom, in your kitchen, in your toilet. Storage is a huge thing. And this whole challenge of 1 and 2 bedroom has come up a lot in our discussions. But our guidelines advocates for a second bedroom, for a carer to stay over. Perhaps there could be an older couple that might move into this property, and one of their needs may change. Instead of them having to move out of the property, one could use the second bedroom, particularly if their needs change. Soft spot between the bedroom and the bathroom. So these are all universal design practicalities that we need to enshrine into our new homes as they are designed and planned for. Adaptation and the need, as the needs increase as we age. Going off my first slide, we need to build that in and be smart and reduce the cost of adaptation as the person ages. Next slide, please. A lot of good work has been done in the sector. Rosalind mentioned my policy, but Design Manual for Quality Housing has a number of different UD typologies in the manual itself, and that's great to see. Age-friendly housing is now an accepted typology in industry, and we need, the Design Manual is obviously looking at standardization, but as a sector we need to streamline how we build homes, not just general housing but also age-friendly housing. So it's very encouraging to see these typologies included in the design manual. Next slide, please. just calling out good practice, and I want to compliment Clon and Clúid Housing. This is a recent design guide that they've published, and 2 chapters, Clon chapter in terms of age-friendly housing, but also universal design. This guidelines is used to inform the design teams, and a lot of good content in it. So I want to sort of call out that, and I acknowledge that as good practice, and a very important publication in informing design practitioners for new builds. Next slide, please. This is just an application I want to mention that the department have created, and it's a site evaluation tool that looks at the proximity of potential sites for age-friendly housing to existing services. A question there in terms of public transport, examining sites on the proximity to public transport, but key, GP services, pharmacists, shops, culture and religious settings, and this tool is a very useful mechanism to evaluate and score sites and see and ask questions of, what considerations planners or designers need to factor in. Next slide, please. Again, just calling out another body of work that's happening at the minute is a new design standard for universal design, an IRIS standard. We rely obviously at the minute on guidelines, but this new standard, which NSAI and the Centre for Excellence have done a mammoth amount of work on, it'll be really welcoming to industry, really to drive at the standardization of universal design, but inform both, I suppose today we're talking about social housing, but also on the private side. So this standard is in train, and as I say, once adopted, will be a great addition to the sector. Next slide. We've done a lot of work across local government sector in terms of development of age-friendly housing, and this is just one publication that's available on our website. Huge amount of diversions between rural and urban settings. So this is best practice and a good insight into what's happened, and again, downloadable from our website. Next slide. And now moving into our models of good practice, and I have a few just to mention. Cornamona Court is a development that Dublin City Council have recently completed. It's an interesting one in terms of its intergenerational structure, where younger families are living on the lower floors of the property, and older residents live on the upper apartments. The units have universal design features. There is a community space within the development itself. It's been a regenerational project in Ballyfermot, and a really welcome addition to the area. A really high quality standard of social housing delivered by Dublin City Council. Next slide, please. And these are just some of the imagery of this developments themselves. The apartments are dual aspect, own door access. You can see the wet room there on the top left. So, a lot of good practice happening there at the minute within the sector that can be certainly replicated. Next slide, please. This is just another variation. It's St. Joseph's in Waterford City, a refurbed or a vacant property in the heart of Waterford City that was repurposed. I know Rosalind has covered off a number of funding models. This particular development was funded through the repair and lease funding scheme that the Irish government introduced as an initiative to look at vacancy across the country. And as you can see there, quite a lot of dereliction in this property. It was once a nursing home and has now been repurposed into 71 1 and 2 and 3 bedroom units. Next slide, please. So this is the finished development, as you can see, and just a couple of interesting aspects of the development. The top right is a chapel that has now been repurposed into a communal space for residents to use. The council have appointed a tenant liaison officer specifically for this development to look at, introducing social enterprises, community spaces. Interaction with developments is important, and these types of communal spaces that have been mentioned is an integral part of building communities. Next slide, please. This is one local to home here in Meath. Again, a recently completed development by Meath County Council of 28 units, own door independent living, a lot of outdoor spaces provided. This development is just solely homes, but adjoining the development is an existing community centre, again used by the residents. A lot of the residents here have right-sized into this particular property. Some have come from emergency accommodation. Some have been in the private rental market and been using HAP. But, you know, listening to their story, and security of tenure is a very important part, not just for older people, for everyone, but particularly, you know, where people are retiring. And it's been mentioned there, you know, having that disposable income to pay your rent, a huge problem that's coming at us across the sector. And you know, so the people that have moved into this property have got security of tenure and has transformed their lives in many ways. Next slide, please. Again, up at the top of our country, I have to call out Donegal County Council have recently completed this development in Ballybuffet. 19 apartments with a communal space, and you can see there an image of the wet room that's been provided in one of the apartments. A lot of adaptation features included in this development. All of the units are universally designed, and you know, it's very so closely located to existing services as well. So again, a very good example of what local authorities are developing and producing. This particular development was designed in-house by the design team in their architect's office, and it has been shortlisted for this year's Age-Friendly Housing Awards. But a really excellent example of what's been delivered by our local authorities. Next slide, please. This development is in Cork City. It's Springfield House, and I know Rosalind and her team has produced an insights paper on this particular development. But this was a vacant commercial property that has been transformed into a residential development of 35 properties for older people. 14% of the residents have right-sized from private, and the local authority have bought up those properties and repurposed them for families on their housing list. The property themselves is managed by Tua Housing, and again, a very good example of what can be done in the sector. You know, repurposing a vacant property for age-friendly housing. You know, a lot of happy residents in this development, and a real sense of lease of life for people that have right-sized into this particular development. Next slide, please. Yeah, I think this is my last one, but again, just in terms of reuse and development, and again, Kat mentioned the housing options for an ageing population, and Emer in terms of town centre first, you know, looking at dereliction and vacancy, which is quite prevalent across a lot of our towns and villages in Ireland. But this one here in Clonus in County Monaghan on Fermanagh Street is just an example of one scheme that has been repurposed. And you'll see from my next slide, if you move on, you know, how the street itself has been, you know, revitalized and repurposed with housing for older people. Next slide, please. You know, a lot of work, as I've said, has been done in the sector, and this is one role that has been created from policy, and it's the age-friendly technical advisor role. There is one person, at least one person in throughout the local authority sector that are real champions at best practice, and I meet with them quite frequently in terms of delivery and promotion of age-friendly housing. But these are roles that are in each local authority, and they're the role essentially is to provide advice, not just from social housing but private. But they are champions, as I say, in their local authorities, and a great resource to have for local authorities, not just in their own direct bills, but also for AHBs that want advice at bringing schemes forward. Next slide, please. You know, one of my roles is obviously working with local authorities, but I also deliver housing and public realm training, again, an action under Housing for All in building awareness and promotion of age-friendly housing and public realm in the sector. And this particular course has been delivered across the sector, local authority staff, AHB, and the private sector. So, you know, if anyone wants to avail of it, please reach out to us in Age Friendly Ireland. It's offered free of charge, and is accredited, as you can see, by the 3 entities at the bottom of the slide. Next slide, please. And again, we have a very good website, Age Friendly Homes, that is managed by ourselves, but we have stakeholders in the housing agency and the two departments there that feed into the website. So a very useful resort as well to show a lot of the information I've shared with you today. So feel free to browse the website and dive in further to the information and resources that are there. Next slide. I'm nearly there, Liz. So, and that's me. And thanks a million for listening to me, and happy to take any questions.
Right. Thank you, Declan. There's a few sort of questions in the Q&A that will come to after the next presentation from John Hannigan, who's the CEO of Circle Voluntary Housing Association, and has got a story to tell about the development of the Inchicore scheme. And just to say, Declan, it was really great to see all the different examples that you were able to share with us today. So I'll just hand over to John now.
Thanks, Liz, and thank you for the invitation to be here today. The session I'm going to go through is really just highlighting one of what is a fantastic number of new schemes that are coming through from the government and also local authorities and our approved housing body sector. We have been involved in the provision of older persons care through the Housing with Support scheme in Inchicore, Richmond Place as it's called now, since 2016, and it's a project that has been ongoing, has had lots and lots of evaluation undertaken, and in fact you can find the evaluations for the project to date on the housing agency's website, and there's 2 more chapters effectively to be delivered on that over the next next 12 months or so. Before I get into actually talking about it in too much time, this is a truly multi-agency scheme. It is a pathfinder. There is nothing that's exactly like it anywhere else in the country, and it has taken a while to get to a place where it's now fully let and residents loving where they live. But there are a couple of people online who I just want to give thanks to, who've been very much at the heart of making sure it got delivered. That's Joan McMahon from the Department of Housing, Paul Benson, and Karen Murphy as well. And not to mention, I have to say, Age Friendly Ireland have been an amazing supporter of the process as well through the whole delivery. But it's also involved the Department of Health, the HSE, Dublin City Council have been one of the key elements of producing what we have now, the Irish Council for Social Housing, and our partners in the actual operational delivery of it, who are Alone, and obviously my colleagues in Circle. Could I have next slide, please? So I want to talk a little bit about what we've learned as well. So I'll get to that towards the end of the presentation. What is it? So it's 52 homes, apartments, which have enabled older people to live with dignity, independence, and community. But more importantly, with security and safety at the heart of what we do. So there are private safe areas, there are semi-public areas, and there are public areas within the whole scheme to give that connection to the community. And it's within a community that has suffered quite a bit over the years in terms of dereliction in St. Michael's Estate. Thankfully, Dublin City Council now have a fantastic plan to deliver more homes in the area. This was a derelict site. It is a mix of 1.5 bed and 2 bed homes, to demonstrate the need and the opportunity for the additional care elements to be provided as people age in place. And it really is, we're looking at the probably extra care type model, and we spent quite a bit of time in the UK examining that model as we were going through the design elements of this. Next slide, please. So it's located, and some of these things are really important. It's located within 500 meters of the health centre, GP services, shops, and Inchicore community hub, but also within transport hubs. So you've got the Lewis and multiple bus routes very close by as well, all within a very short walking distance. It provides, what we're trying to do is provide that support, autonomy, and community living, but also encouraging right sizing. And we've been very fortunate that we've been able to work with DCC in terms of the financial contribution scheme to enable a number of the people who have moved into it now to sell their own home and have the opportunity then to be living within the scheme. Well designed is an understatement. It is, in fact, an award winner both in Europe and in the RIAI awards for its design. So we're delighted with that from that perspective. And OBFA were the key architects who were involved in that process. its own door. There's plenty of autonomy. What we're trying to ensure is that there's a connection within it that creates a community. So there's extra wide landings areas, as it were, for people to be able to have that space to get together, to come together as a community, as well as specific areas within the building that are communal areas for people to be able to enjoy each other's company. Can I have the next slide, please? So these are just some pictures to give you a sense of it and the scale of it. Next slide, please. I put this one in particularly, not because it looks good at night, but because of if you look into the distance in terms of the picture on the left, it's at the heart of a community within Inchicore. It's within, you could say, city centre in many respects as well. So from that perspective, it is very much connected to a community. The people who have come to live there have come out of the community, and that's been one of the critical things we think that has made it successful. This is in a state that has had huge difficulties. In the middle picture, you'll see the big green space at the back, which is now a building site, or soon to be a building site for 458 homes being delivered by Dublin City Council. If you can imagine, for that green space at the back, there was a huge amount of objections, thousands and thousands of objections. When we went into the community to talk about how we were going to deliver this particular scheme, there were zero objections from anybody. And that's because the nature of it, the design of it, we've been sensitive to the local area at the back where the height of the building has been kept to an appropriate level to enable us to get some scale, but also to give that sense of privacy for the people living there already, but also the people in the new homes. Next slide, please. And again, you can see on the right-hand side, it's built to Universal Plus design. So we had a lot of work, and I have to say, go back to Joe McMahon, who was hugely influential in terms of helping us get through some of the design issues that we had in planning. But the reality of it is that it is built to give that little extra space, give that little extra I suppose, opportunity for family and also carers to be able to reside with the individuals that are living there. There's also a significant amount of additional storage space within it. One of the key design elements is that you can see from front to back in all of the apartments, and you can see there's plenty of light coming through there at the front, but also at the back as you come through the main door. Lots of soft spots within the key walls that would enable people who may develop issues with dementia at a later stage to be able to have openings put in for access to bathrooms, etc. But also we took out approximately 10 doors out of the whole process through the design element of it to enable that free flow space, but also take away the confusion that may exist in future years for people where they try to work out where they should be. And obviously a couple of our tenants there receiving their keys. Next slide, please. So what were the lessons learned? Well, there's already been a bit of discussion around what funding model we should use. This one was funded under a capital assistance scheme. It's a complex model. It was in the original format as well with the 4-stage model before it was reduced down to 3. My understanding is that that's going to go to 1 at some point in the future, which I think would be fantastic. The problem with this model, while it's 100% of the capital, and that's really useful and helpful, it has a lower level of rent attached with it. And as a result of that, then the longer term maintenance and management costs of the scheme are not really covered as well as they could be. So there are other schemes and other methodologies for funding that I think still need to be considered for the future. And it comes with the same requirements as the other models in terms of who we let to. And I'll speak a bit about that in a few minutes. One of the lessons we learned was make everything official from the outset. This was based on an MOU, a memorandum of understanding between all of the parties involved. And what we found over, as you can imagine, nearly 12 years, that the nature of those agreements change. The nature of understanding changes, people change, the nature of who is actually dealing with it changes quite considerably over that period of time. And as a result of that, the knowledge and understanding becomes a bit more fuzzy, let's put it that way. So having a contract from the start is really important that outlines exactly what's to be delivered by whom and when and at what cost, something that wasn't there at the very beginning. Ensure the funding for all new elements is in place. So for example, in this particular scheme, there's a lot of technology. That technology wasn't funded initially. But there has been a significant contribution now put in by the HSE to support the delivery of some of that. But it was something that had to be considered additional towards the end of the project, which created some delays and also some complications in terms of the completion of the property itself. The other bit here is the communal areas. So at this point in time, none of the current models that we have from the state really account for or allow for significant communal facilities to be provided within these buildings. And they are a substantial cost, particularly for older persons, where there needs to be that little bit more thought in the design and also in the, I suppose, the size of the property, the areas that are involved. So that is a key area of concern at this point in time under all of the current funding mechanisms. But given that we know that we need these spaces, it is something that probably does need a bit more consideration. The community spaces matter very much. And they matter from the point of view, on this particular scheme, we ended up with a space that's a third of the size that had been originally planned because of the cost implications of providing it and the funding elements that weren't available for it. So that has had impacts in terms of taking out, for example, a cafe that we had built in, which was a part of the interaction and interface with the public areas within the scheme. But it also then reduces the treatment areas that there might be, and also the availability of spaces for people to come and meet as a community in safety within the building itself. So the community spaces really do matter, and funding for those elements really need to be considered. I put in here, be sure about the care continuum and stick to it. So over the period of time, there's been significant levels of change from the understanding of what level of care might go into this, or nature of supports that might be required for this particular scheme. When it was originally conceived, there were kind of three levels: high, medium, and low support. And that high support was there to help people who would have been closer to nursing home requirement to stay in their community and live in their home within the building. Because of the nature of that and the understanding of that level of care and the cost of providing that level of care, it's been now modified, and we now have 4 levels of care, and the highest one, it doesn't really get to the same standard, albeit that it is still very significant. So there's a lot of change that happens now over a period of, as you might imagine, 12 years. Then yes, there's always going to be change, but the understanding of what this project was for, which was to hit that bit of extra care, as it were, towards the end of people's requirements, became something that was harder to deliver. Next slide, please. So how do you do more of this, and is it possible to do more? Well, first of all, we need to use the correct funding model, and I'm not sure that we actually have it at the moment. I think it's a hybrid between a number of different models that we currently have within the state, and the evaluation process that's ongoing by Kathy Walsh and the Housing Agency, I think, will help enormously to try and determine what that might look like. It's already been said by and through some of the questions that we've already have, and from Declan in the previous one, location is everything in respect to where these properties are built, close to transport lines, close to amenities, close to health service elements as well, really important. And finding that usually means it's probably the town or city centre to make it the most viable project, and to ensure that those who living there don't become isolated. Make it multi-tenure. So at the moment, it's primarily based on a social model. But it should be a social, affordable, and private model within the one envelope. And the reality is that's difficult because that requires different sets of funding from different parts of the Department of Housing and other areas as well, the HSE. So I think it's probably something that we need to do. And to enable it for cross-subsidy, where those who can pay, that's great, but where those who can't, then they need additional supports. And making it a multi-tenure approach, I think, is something that's really important. But it can be done, and there are examples where that has been demonstrated across Dublin City. We know that this can work at every local authority because it can be upsized and downsized to what's required. We think that probably the smallest level of care, the lowest number, is probably about 26 homes, but this could go up as far as 150 homes in the one place, given the right supports attached to it. But to do that, then as I say, the funding models would have to be considered. And then finally, change the planning laws to recognise specifically older persons and senior living. While we do have the recognition of the universal design, and that's very much welcomed, but there's actually very little in terms of the language of recognition for older persons and senior living within the planning legislation at this point in time. So I think that's probably something that we will need for the future. So that's it. It's a quick whirlwind tour around Richmond Place, our housing with support in Inchicore. So back over to you, Liz.
Great. Thank you, John, and thanks to all the speakers. I'm just aware we've got about 4 minutes, and the last session was going to be an invitation to each of our panel to just say 1 or 2 things that they think would be important to take forward. Given that we've only got 4 minutes, I'm actually going to give each of you 30 seconds to just say what you think is the most important thing to kind of progress or to notify policymakers, or what's our kind of ask really. So if I start off with Joe Gallop, I don't know if you're able to give us your one takeaway. I don't know if Joe's there.
I think he had to drop off, Liz.
Oh, okay, fine. Okay, so then moving on to Roslyn.
Hi, Liz. Yeah, I suppose just in 30 seconds, I think everything has been building up to show that policy is to have a range of options, is to have the choice, have autonomy for older people to remain living in independent living. And I think the last point that John Hannigan made around ensuring that the funding models to have that across the health, the social care, and the housing incorporated, and that they work for these homes to be built is really important.
Fantastic. Thank you. Dr. Emma Coveney.
Just 2 points. One is, I suppose, around the data. Like, there's an awful lot of new developments coming on stream, and there's fantastic examples in that, but we don't really have a national data set on age-friendly housing or housing that's been adapted or where people have right-sized, or even I know we have the grants, where grants have been made, but what actual adaptations are made with those grants, I don't think there's a national data set. So that would be something we'd be keen to see progressed. And then I suppose our whole ethos is around involving older people and the kind of citizen participation, and that, so to kind of keep that to the fore as well with new schemes, that older people's councils are there to give their views and help shape their communities, and they're a resource to all parties in this in terms of design and delivery of suitable housing for aging communities.
Brilliant. Thank you. Thank you, Emma. Bruce.
Yeah, thank you very much. I think it's been great to hear everyone. There's lots of commonality and lots of things we can learn from each other. It's been great to hear that. But the one thing I would say is don't underestimate the importance of having a strategy to give that priority, because there are different models, different ways of doing things, but without that strategy drive, the danger is the focus goes away from older people. And I think the age-friendly island, I think, is really positive to have that as the overarching concept in Ireland, and hold on to that. You're very lucky to have it and help cherish it, definitely.
Yeah. Thank you. Thanks, Bruce. Declan, any?
Yeah, just one thing, Liz, I suppose it hasn't come up. I suppose we have an aging demographic, but in years to come, we're going to have less people of working age. And this is just not unique to Ireland. It's happening in Japan at the minute, where, there's smaller family sizes. So I think that's something we need to build into housing models. How are we going to care for each other in years to come? And John has touched on it there. I think, obviously there's going to be huge need for care, but we have to support each other, and maybe, community-led housing maybe is an option, but I think we have to be smart about how we're going to build our communities into the future. That's something really that I think needs to be considered in policy as well, and creating those intergenerational developments as we build housing.
Sure. Thank you. Thanks, Declan. And finally, John.
Yeah, I'll repeat one of the things that's been said 2 or 3 times, and that is the funding models, I think, really need a bit of work. The state is incredibly generous, I have to say, in respect of what it does and how it does it. But I think the nature of the bureaucracy, which comes with state funding, makes it more difficult to get it across the line in an expedient way. So yeah, let's see the state funding element of it reviewed.
And Liz, Dr. Jerry's joined as well.
Oh, okay. Hi. Thank you. Would you like to say a word or two?
How much time do I have?
A couple of minutes, unfortunately.
Okay. Well, first of all, my name is Jerry Cowley. I'm a rural GP, and I just want to say this much. Community, by community, for community. This is where people are. They're in their community and they're living here. And I came here as a young GP 44 years ago. And all I can tell you is that we have something here for the last almost 30 years, 27 years, which works. It's stood the test of time for 30 years. It has worked because of partnership between Mayo County Council, the government and the community, and it continues to work. There are problems, but joining all the funding systems for older people will solve that very clearly because there is an inequality there. The second thing is this, is that we see rural doctors has been fundamental to all of this. We're losing rural doctors, ending up in the A&Es. We can do work here. We are doing work here. What we have here, we support people at home with our day centre and daycare. And then we have our sheltered housing, and then people can move sideways to high support care. We give complete care here. Where is complete care and all that has been talked about so far? We need a policy that includes older care. It also needs to include the people that are in inappropriate settings like long-term residential care units. And we know that it's all wrong. We know that people are best in their own area. That's where people want to be. And that is all possible and it can be done. We did it with the capital assistance scheme. We are now under the fair deal scheme for the top end of it. But I'm saying to you, I know as a former chairman and co-founder of the National Federation of Group Border Schemes, and as a former vice president of the ICSH, Irish Council of Social Housing, there are day centres, there's social housing all over Ireland as a result of rural communities. Rural communities have not done the high end of it, supporting people to stay in their own area like we have done. Why? Because there's not the government support there for it. We need that. We need older persons housing as part of central policy. More than that, we need to include the people that are inappropriately placed in long-term care. They needn't be there. They can be in their own community where they belong.
Thank you. Thank you. And I think you make a really good point about using the resources that you've got in the community, particularly in rural communities, because that was an issue that somebody raised earlier about, well, how do we address the sort of housing, care and support needs of all. So thank you. That's been a really valuable sort of contribution and a bit of a rallying cry, I think, for everybody at the end there.
Thank you very much indeed. Community
thank you.
And aging in place is what it's all about. That's where people want to be. That's where I want to be. Thank
Absolutely.
you.
Thank you.